That is smartphone on slit lamp. Okay, only one. Only one. How many of you are using, okay, one, two. How many of you are using the slit lamp camera? That is a slit lamp camera with a dedicated computer to it and all that. Very few. Okay, so we will see the quality difference between the pictures taken with a smartphone, because somehow or the other, the smartphone cameras are much better than the ones which are integrated in the expensive commercial slit lamp cameras. I don't know why, but that is how it is. So you can see the quality difference between all that. And I think we will also see how to take fundus photographs with smartphone. How many of you are using apps to take visual acuity? Apps for color vision? Okay. So the app for color vision, if you look at it, the one which is on the phone has much better colors than the cheap ones which are available here. If you take the original Ishihara chart, that is the good color, it's good color grading. But if you take the one which is say 200 rupees, 300 rupees, the colors are off. Colorblind people will be able to read that, and and that is because not because they are not no, not because they are not colorblind, but it's because the colors are off. Okay, I think without much further ado, we will start with the first thing. That is Dr. Prithvi Chandrakant, smartphone ophthalmologist, innovator. He doesn't need any further introduction because he is there in every conference winning so many awards. He is going to talk to us about eye examination in your fingertips. Over to you, Prithvi.
Thank you, Dr. John, for the introduction. And I'm Dr. Prithvi. I'll be taking over from here, smartphone ophthalmology. First, I'll be going to the anti-segment imaging devices. So, as we all know, slit lamp cameras are very expensive. It comes around 1 to 2 lakhs, and it is not very easy. You need to on it, you need a CPU, all those things. What if we had something much easier? So that is what is slit lamp freehand examination. So here we have Dr. John explaining to us how he uses a smartphone with freehand examination. So you can even take an image of this QR code and it will take you right to the YouTube link. So over here you can see you need to keep the phone a little away from the eyepiece, and you need to get a proper round. So you need at least of one finger distance between the eyepiece and the smartphone. Only then can you actually take the image. But it is very difficult because it keeps shaking. Your hand keeps shaking and it becomes difficult. So that's why we have another a product, that is a adapter. So this adapter can be used, and we can also buy it in Amazon for a amount of around 600 rupees. So this is also another way we can do this. So you can attach a smartphone to that adapter, and then the adapter can go on the eyepiece of the slit lamp. So you need to keep the phone camera centrally, and then so it can be adjusted also. So once you keep it in the center, and you can so the distance between the eyepiece you can adjust if you have a adjustable eyepiece. Otherwise you need to place it at least one finger gap or maybe 1 centimeter gap between the eyepiece and the smartphone. So that's when you get the proper round of the slit lamp image. And it is very easy, it's not very difficult. The only problem is you need to keep removing it now and then. Even fundus photo you can take with the 90D. So what if you don't have a slit lamp? So that is where our new this innovation comes. That is anti-segment photography with intraocular lens. This also you can take a photo of the QR code. So over here what we do is we are using a chart paper. So most likely better to take a black chart paper. So it is a 10 centimeter to 1.5 centimeter long chart paper which you can cut out, or you can even use your ID, KSOS ID to do this. So, and then you add a double-sided tape inside this thing. So you need to fold it and put a double-sided tape. Before that you can mark the area where the IOL, that's the intraocular lens, will be put. So this is the area. So between that we put this is a double-sided tape. So you have a sticky surface in both the sides, which is put inside the chart paper. And then using a paper puncher, you just have to punch once on top of this chart paper. So once you've done that, you get a nice round cutout. And now inside this, you are going to place a intraocular lens. So intraocular lens, you can put whichever 15, 20, 25 to use it for anti-segment. If you put a 15 diopter lens, you can get a full corneal image. If you want a more focused or more enlarged one, you can put a 20 or 25 diopter IOL. So once that is done, it's sandwiched inside, and then you have to put this on the smartphone. So you need to find out which is your primary camera lens, and then you put this into your smartphone. So it makes it into a macro photography device. So it will be clear. You can, and this can be used in any phones, like with cameras in the center or at the side. So how to use it? Once you put that, you take a video mode on the flashlight and go near to the eyes, and you can start taking images. As you can see over here, you can start recording the images and you get the whole image from the recording. And you can even zoom your optical zoom in your smartphone, so that will give you more enlarged images. So these are few images taken in the smartphone with ASPE and without slit lamp. So iris mask, giant papillae, neovascular glaucoma, corneal nerves, keratoplasty sutures, blue dot cataract with PSC, occlusio pupillae, pupillary membrane, and hyperpia. So these are all taken without slit lamp. So it is very easy. You can always keep it in your phone, in your pocket, and you can always take it. And recently we have even made into a 3D printable tool. So that can be used by just like a clip-on. So this is a video showing phacodonosis and iridodonosis, which clearly you can take it from this device and without a slit lamp. So as I said, ASPE, you can use anti-segment imaging with 15, 20 or 25. But what about other IOLs? So we started exploring more, and we found that if you took any IOL with 6, 8 or 10 diopters, you can even use it for gonioscopy. So we are replacing the slit lamp over here, not the gonio lens. So with the gonio lens, you take your smartphone, keep it near to the rim, so you can take images of the gonio angles of the anterior segment also. Over here you can see ostium opening, you can see PACS, PXF glaucoma, and angle recession due to trauma. So all these are images which are taken without a slit lamp, only with the 6, 8 or 10 diopter IOLs and with a gonio lens. So this can be taken by sitting position, standing, or even lying down position. Next is the IOL scope and slim. So basically we all know that microorganism we are not able to see the smartphone. So we thought, why not use intraocular lens? So we used 4 30 diopter lenses over here. So we explored more with intraocular lenses, and we used 4 30 diopter IOLs, and we stuck with the liquid adhesives, one above the other. So it gives collectively around a 120 diopter power. So carefully place it one upon the other, and then use this exactly like how we use it as a ASPE device in our smartphone. So once you've done that, it actually magnifies your phone and converts it into a microscope. So now what you need to do is, you need a slide and you need a illumination from behind the slide, which will help you take the images. So this way you have attached it to the phone, and then you need a source of illumination from behind the slide. So here is a torch onto which a slide is placed, and then you can start taking images in the video mode. You don't really have to on the flashlight. So once you've done that, you can start taking images of fungus. Over here you can see a rhizopus slide which has been taken with the staining. Here is a KOH mount of fungal hyphae. So these are all images which were taken. This is a larvae of a sheep bot fly. This is a caterpillar hair which has been taken. So these can all be done in your OPD setup itself. You don't really have to leave your room. So you can just attach this and you can start taking images of all these things. So these are all prefixed slides which were taken. So once that was done, we thought why not use it more, explore more. So we took it to the operating theater, where we went to take orbital mucormycosis case, where ENT surgeon has been debriding the tissue and giving it at that same moment. And then we started taking images, and we could actually find out the hyphae from this tissue. So it could actually help the ENT surgeon fix the amount of tissue which needed to be removed. So, and then we even took this and we took it and compared it with the actual microscope. You can see over here this hyphae from IOL scope, and this is the hyphae which was taken in the laboratory microscope. So then we thought, why not make it uses for our own slit lamp, in our own slit lamp. So how can we incorporate it? So basically we see a lot of cases, corneal ulcer cases in our OPD. We need to take it, we make the slide, and then we send it to the laboratory. So it sometimes takes time and all those things. So we need a laboratory setup also in our hospital. So what if we have, so over here what we did is we made the IOL scope place in the slit lamp itself. So now we have the adapter which we bought it from 600 rupees in Amazon, and the torch, and the IOL scope is readily available. So we fix this IOL scope to the slit lamp. So a small adjustment what you have to do is you have to remove the illumination part and then fix this adapter over there and refix the illumination part to the pivot joint of the slit lamp. You can even put it on top. If there is a place on top here, you can even put it over there and then fix it to the slit lamp. So once this is done, the adapter is then fixed with the phone attached to the IOL scope. So when that is done, what happens over here? So previously IOL scope, you need to have the free hand, so it moves. So over here you don't have to worry about the movement. It is fixed on the slit lamp. It gives you much more stabilized control over this thing. And once you put the slide, you can start taking images of the corneal ulcer, KOH mount, whatever is required at the same bedside. So here is a sample of how it's been done. So corneal ulcer been taken, scraped off, and then you put it on the slide with KOH and then put it right there and start taking images. So you can actually, it's like a more of a bedside thing. So over here we can see how we are diagnosing the fungal hyphae in KOH. And these can be done in various slit lamps, even the Hack Street model. So this was about the IOL scope and SLIM. So we have also used this for diagnosing of Demodex and a sheep bot fly, in which we take we have compared it with the microscope also. Then we come with another innovation, that is slit scope. So basically the need arises when we went to camps. So all of us, we know, we go to camps, we have only our torchlight. There is no slit lamp. Sometimes it's very, very difficult to get the slit lamp and all the fundus cameras to the area because it might get damaged and then it costs a lot. So what the problem statement here was, what if we could make an instrument which would replicate the slit lamp and hence be used in community outreach program. So the solution had three main things: magnification, slit lamp illumination, and image device. And we already saw that the magnification and imaging device was taken with the ASPI and the smartphone. The only thing over here was the slit illumination. So that's why we came with the slit scope. So we opened the slit lamp and we saw what are the parts of the slit lamp. So we had a illumination device. There was a slit opaque substance, and then we needed a lens which would focus the slit. So over here we use the IOL again. So here we can see how we use the opaque substance as a chart paper, and then we put it on a torchlight and an intraocular lens. I think it was a 23 diopter lens which we used this was the first time we tried this. And like you can see there was a slit. So we used a moon shaped torchlight. That is what we get it in Amazon for around 200 rupees. And this is the first image which we took on my own eyes. And you can see the slit has come, but it is a little broad. So we can actually change the slit width accordingly. So this is the first time we tried, so it was a little broad. And then we thought, why not start 3D printing this? So we took the technology to 3D printing and we started designing devices of different shapes, size, circle, square, all type of, and it came up to 350 rupees, and we just added it to the torchlight, and along with ASPI and slit scope together, we are able to take images as equivalent to that of a slit lamp. And that also not even as much as, which doesn't even cost you as much as a slit lamp, like maybe few thousand rupees. So yeah, over here we have corneal scar, PCIOL, low dot cataract, sutural cataract. You can see brown cataract and mature cataract being taken with this. So this is what ASPI and slit scope we have been using in our cams right now. So it's simple, cost effective, and it's do it yourself. Can be an alternate to a slit lamp in the future. Then we come with the smart scope kit. This basically what happened is, then we thought if we can have ASPI and slit scope in our community service, why not take all the devices which we have made, we have created in one kit. So that is when the smart scope kit arose. So this kit is basically is a comprehensive ophthalmic kit which has almost all the devices which we use in our hospital. So the first one is the visual acuity. So we use our smartphone visual acuity test, which will be talked by Dr. John in our later presentation. So this is used for visual acuity testing, and basic visual acuity testing requires pinhole, occluder, plus 10 diopter lens, and a trial frame. So these are all included in the smart scope kit. So this takes all the visual acuity tests, and then we have tools for investigations. So here we have the torchlight, slit scope, BP apparatus, pulse oximeter, and then we have dilating anesthetic drops, glucometer, syringing cannula. All these are all basic ophthalmic examination tools which we have in our OPD. Then we have forceps, sterile 26 gauge needles, fluorescent stain, spatula and slides with wipes, hand sanitizer, and even gloves. So these are all the investigation tools we have in the kit. So these are all kept. And then anti-segment, as I showed you, we have one more eye verter. This is also an innovation we have done. So this helps us to evert the eyelids when it is very difficult for us to do it. And then we have the ASPI, we have already seen, for anti-segment imaging. So these are all the images which we have taken in our outreach programs, and all these are all not slit lamp images, not at all. It's all done with the, and these are all images of the ocular trauma images which we have taken. All these trauma cases you can see, these are all taken with the ASPI only. And then we have the KSOS tonometer for IOP, and then ASPI gonio for testing of gonio images in outreach programs, and then even parasites and for fungus detection in outreach programs. Also Scooby-Doo, which Dr. Shishir will talk about. It's also a ASPI variant for the cobalt blue filter. So these are all comprised of the anti-segment, and then posterior segment we have the trash to treasure red cam. This also will be covered by Dr. Shishir, and a few other red cams which can be used. So this is basically the smart scope kit which we made for a comprehensive ophthalmic kit which can be used for visual acuity, refraction, investigations, and for the anti-segment, you can use fingers for everting eye verter, for slit lamp ASPI and slit scope, for Shiots and ASPI gonio for gonio imaging, which was never done before because we never used to get slit lamp in our community service area. And then even blue filter was not available. So now you can, all of these things are actually there in your pocket right now. So you just need to do it. This is actually basically a do-it-yourself thing. So it can be done by anybody in your house, and you can use it for your benefit. Thank you.
Thank you, Dr. Prithvi. So as he has elaborated all the imaging techniques using the smartphone, the smart scope kit will be beneficial for all the residents and all, especially when they go to outreach. You have all the imaging modalities which you can take on your phone, send it over to your peers or your senior colleagues, and then they can view and give you guidance on what to do next. So that's the main advantage.
Next we have Dr. Shishir Varghese. He also needs no further introduction because he is yet another smart innovator from Kerala. He has won 3 international awards this year. So I think last year it was only
Thank
two.
you.
Oh, four. This year is four now. Okay. So going by that progression, every year it'll be like 6, 8, 10. So I don't know, maybe in another 10 years it'll be a very big number. So before he goes all international, you can catch him and get to know about how to use these smartphone image devices for ocular imaging. Over to you, Dr. Shishir.
Thank you, Dr. John, and kindly don't jinx. Okay, so I'll be talking about some couple, 2, 3 more devices. So no financial interest. So we know there are multiple devices for fundus imaging, which are the non-mydriatic and the mydriatic cameras. So it's quite expensive, especially the minimum base price for a fundus camera is nothing. I mean, less than 20 lakhs. So you have handheld cameras now available for 2 to 3 lakhs, and even now we have smartphone-based cameras which are available for imaging. So smartphone-based imaging has been described right from 2010, and it's extremely useful for outreach and purpose for CAMs as well as for resident education. So few previous red cams have been studied the same way how Prithvi showed, to connect the smartphone to the slit lamp, and then you can even obtain posterior segment images. Now there is a do-it-yourself red cam. There's also a Me red cam which was developed by Dr. Ashish from Lotus Eye Hospital, and also a JS red cam by Dr. Jayatra. So also Welch Allen has provided this handheld smartphone-based red cam, and also a couple of others by Peak Retina and DI. The one with the DI, the advantage was that it could view around 200 degrees of field. So even the Voke InView smartphone camera is there, but the only disadvantage is using still an old model of an iPhone, and only an iPhone SE or an iPhone 5. If you still have it, you can use the Voke InView, and its cost is around 2 to 3 lakhs. So again, useful in very peripheral health centers and all. Now Dr. John has developed his John Das Pocket foldable fundoscope, which is 3D printed, and it has a pocket for the 20D lens also. So you can connect your smartphone at the one end, and one end you can keep your 20D lens, and you can take pretty good images with it. So this is how it is. You can put it in your pocket, and you can unfold it, put your lens, put on your smartphone, and you can take images from that. So it's a low cost, ultra portable. Is it really low cost now?
After patent process, it is only 9,999.
Yeah.
Better pricing. Actually, this is the old model. The new model is 9,999. That includes inbuilt illumination, magnetic docking, and all additional features. So,
yeah. So it's ultra portable basically, and you can use it as a case for your 20D lens. So these are some of the images which are obtained from it. Now we'll talk about the trash to treasure red cam. So it's a simple, affordable, portable, wireless, and do it yourself posterior segment imaging. So you take a sanitizer bottle, make a cutout, and insert your 20D lens there. So this is how this is the video showing how to do it. So you take a scalpel and cut out the one part of the sanitizer bottle, and so that becomes your holder for your 20D lens. So now those who are using other lenses like 2.2 or even 18, 30, all these won't fit, and plus that will give more of glare and reflections. So 20D lens is the ideal to be used with the trash to treasure red cam. So again, this is the same smartphone holder which is available in Amazon, and you can connect it to the sanitizer bottle. Put in a chart paper to reduce the amount of reflections. A black chart paper is preferable. And now it's ready. So this is a universal smartphone adapter, and it's available for 490 rupees in Amazon. Yeah. So the principle is the same, like how you do an indirect ophthalmoscopy. So instead of having your smartphone replaces your eye, so in the same way, the smartphone takes the image from the posterior segment, and you get the image with which the video based, you can take the image on the smartphone. So you need to do a video based, you need to do a video based imaging. A photograph won't suffice. So dilatation is important, dark room is important, supine or sitting you can do it. Support the device with your index finger, and then your smartphone you can focus it manually with your hand, and you can get good central images. For peripheral images, you need to ask the patient to look up or down to get the images. And the image recorded is inverted and laterally reversed. So there are few apps which are available which you can use to enhance the quality of your images. So these are the T3R in action in peripheral centers, in CAMs, ICUs, bedridden patients. For all of them, you can utilize this trash to treasure red cam to obtain good images, and it's also useful in ROP screening as well as diabetic retinopathy screening cams. So these are some of the few images which are obtained with it. You can see multiple images: macular scar, coloboma, diabetic retinopathy, myopia. All this can be, good images can be obtained with the trash to treasure red cam. So there is a small learning curve. You'll soon learn to, once you start using it, you learn to hold it with your hand properly and adjust it, and so that you can get good images. And you should know that the smartphone flash should be coaxial with the camera. Otherwise, the images will be really dull and they won't be having a good resolution. So it has been used to study in diabetic retinopathy cams, and grade it mild, moderate or severe NPDR or proliferative DR, and you can see good quality images can be obtained using this very cheap tool, and then you can forward it online and show it to your peers or your colleagues and forward it to your seniors and ask what is the next line in management. So it's a big handy tool. Especially when it comes to cam screening and all. So it can be used for diabetic retinopathy, glaucoma, in pediatrics teaching, as well as in emergency medicine. Sometimes they call you to the emergency medicine to see for papilledema and things like that. And also in ROP screening it can be used. So advantages, so both photos and videos can be obtained. Non-expert examiners can use it. So it improves the cost effectiveness, affordable and portable, and examination of immobilized patients, and also for telemedicine and teaching. So some few disadvantages: the small learning curve, like I said, there may be a glare which is caused by the tilting, or if you use a lens other than 20D lens. So next we come to smartphone aided cobalt photography. So we know that cobalt photography or cobalt imaging is important. Fluorescent imaging and staining is important for corneal pathologies. So instead of taking pictures on the slit lamp, we have developed cobalt photography using the smartphone. So you use a cobalt filter and attach it onto the smartphone camera, and then utilizing the same principle of ASPE, what Prithvi showed in this presentation, you can get multiple good images of all corneal pathologies. So you can see the first one, it's like corneal epithelial defect or recurrent erosions. Then these are corneal filaments. This is herpetic keratitis. Then you have in this image showing Siedel's positive Siedel's test or leakage, and it can be used over your central smartphone cameras or also in your peripheral smartphone cameras. So next we come to the retinoscopy. Now, who ever thought that you can teach retinoscope using a smartphone? So refraction, I have not been taught refraction. I'm pretty sure most of the PGs who are there now, optometrists do the refraction for them. And so this is a good technique or a smartphone based technique of learning refraction as well as teaching refraction. So objective refraction is skill dependent. You don't get a live demo. Whatever the examiners see, you don't get to see it, and that's where the smartphone comes in and plays a role in helping you learn refraction. Yeah, so you know that with movement reflex, against the movement reflex, all these things, you don't actually witness it when the person does it. You have to you do it yourself, and then you have to ask your seniors as to what did I really get. Did I get a with movement, or did I get an after the movement, or did I get a scissoring reflex? We don't know. So that's when you have a smartphone. So we combine the smartphone with the gimbal. Now gimbal is a device available on Amazon, as well as it's similar to the smartphone adapter, and we attach the smartphone onto the gimbal, and the gimbal is attached onto the the holder or the retinoscope. So this is how we do it and construct the gimbal scope. So we take the retinoscope, attach it onto the gimbal, and your gimbal scope is ready. So now utilizing the smartphone itself, you can see real time when the examiner does it, and if the smartphone is attached, you can see real time the reflexes obtained during your retinoscopy procedure against the movement, and you see how they neutralize it. So all this is observed by the trainee live while looking at the smartphone. You can obtain the scissoring reflex. So initial assembly is there. There's a learning curve, and sometimes it's difficult to access to the focusing sleeve. So gimbal scope is a frugal, do-it-yourself, and refraction technique, and you can do live demo recording, and then you can, once you have the smartphone, you can discuss it with your peers and see the kind of reflexes which are obtained. Yeah, thank you.
Thank you, Dr. Shishir, for that innovative talk. I think a lot of people in the audience have their minds open to the possibilities with smartphones. I think many of you, most of you have hated refraction, and many of you who love refraction hated that the others whom you wanted to teach it to hated refraction, and this is a method to teach refraction. You can put your smartphone onto your scope and teach refraction so that you can show how it actually is seen. So over to you.
Thank you, Dr. Shishir. And we'll have Dr. John now. So Dr. John has been a mentor for me and for a lot of people. He has been inspiring us with innovation, striving us to do more every time, publish articles and all those things. And name it, and he knows everything about everything actually. So you just text him and he'll give you 100 texts back with all the information regarding whatever it is what you want to know. And today he's going to give us a talk on smartphone apps. So this is going to actually be a talk of everything. Over to you, Doctor.
Thank you, Dr. Prithvi. So now we have seen how smartphones can be used for eye photography, that is anterior segment, posterior segment, with the slit lamp, without the slit lamp, with adapter, without adapter, doing retinoscopy, doing tissue microscopy of all things. Tissue microscopy with smartphone, I think none of you have seen it before. So you don't need a lab microscope. You can just use your smartphone. You can use your torch, put everything in your pocket. Slit lamp and lab microscope is already in your pocket. Now we are going to the things which smartphones are actually made for, apps. So apps for smart ophthalmologists. So conflict of interest, I do have a lot of apps which I made, but they are all free as of now. So no financial interest as of now. Maybe later. When I started making apps, it was during my school days where I learned C++, QBasic, Logo, Turtle, HTML, JavaScript, and made some games, made some websites. And all these are QR codes. You must have noticed in Dr. Prithvi's and Dr. Shishir's presentations, all those QR codes, they link to the articles and videos. So after that, during medical school days, we made the medical website, we did some flash animations, we made a surgically induced astigmatism calculator, all because we needed it. We made a period of gestation calculator because the OG PGs made us sit and calculate all the period of gestation for all the patients. Only then we could go for break. So we made this. From my batch onwards, everybody would finish it quickly and go off for break. And the OG PGs are wondering how we finished it so fast. So then ophthalmology residency days made some apps for ophthalmologists. Eye Grader, which has all the grading systems in ophthalmology. I know Tamil because when I was in Tamil Nadu, this would help you to communicate with the Tamil patients. Bangla, because we had a lot of Bengali patients also. And 3D Atlas of Ophthalmology because I love 3D. And let's just look at the normal flow of an eye clinic. So we start with history taking, general examination, and so on. What can we do in history taking? During the COVID pandemic, we were thinking of using video calls for history taking. And instead of going through the internet, we could do a direct call from phone to phone, but not required now because COVID pandemic is over for now. Then, of course, the I Know Tamil, I Know Bangla apps for language translation. Then for general examination, pulse rate can be taken on any phone with the camera because the camera can sense the change in illumination through the flashlight. Again, there was also something for breath counting by checking the movement of the chest. These are all not required for ophthalmologists, but ideally you have to know all this. And you can check pallor, you can check cyanosis, you can check icterus. All these we don't consider at all because we are ophthalmologists. Vision is where we really need an app. So there is something called the iChart Pro, which actually connects an iPad and an iPhone, and it is a visual acuity chart with all the things, and you can control the iPad using the iPhone. I don't think there is a proper one for Android yet. We will make one soon. Then the other one is the Peak Acuity app, in which you use a small smartphone alone. It is only for Android as of now. And you can sit at 3 meters or 2 meters and check the visual acuity by using the e-chart on that. Then stereo acuity, you can use red blue anaglyph glasses, that is 20 rupees or so online, and you can use this NTU RDS screening test app to check the stereopsis. If you want to get the actual stereopsis testing chart, I think it is almost 20,000 rupees or so. You can use this by using an app. Ocular examination, you can do all measurements using an app called Image Meter, in which you have to have something of known size, and you mark that reference marking on the app. Everything else you mark, you can measure automatically, including areas, angles, areas, lengths. Eye position and movements. Eye turn can be used to look at the eye turning. Eye tilt for abnormal head posture, and 9-gaze app for taking 9-gaze photographs. Anterior segment photography, you have already seen the presentations earlier. You can use your smartphone. You can use it either barehanded. You can use it with an adapter. You can use it without a slit lamp by using the intraocular lens. And many people ask, what intraocular lens? It is the one which falls down during your training. So it's the cheapest intraocular lens which fell down during their training in Arvind. When during cataract surgery, they put the lens, somehow the nurse gives you and it falls down. That is the lens which we used. Okay, so it's not some expensive lens. You can get whatever cheapest intraocular lens you want. Any sample lens, you can use a sample lens. You can take good photographs by adjusting the illumination. You can take gonioscopy and you can take fundus photographs. And so this is the IOL scope, the ASP, and of course the IOL scope is also there. I'm not going to go further in those. Then there are apps for toric axis marking. This one, iToric Patwardhan, is very useful. Toric IOL axis marker is also useful. You can mark the dot, and the phone's gyroscope will be able to tell you how much rotated it is. So then on table you can mark it correctly by subtracting that. Then fundus examination. This is the foldable fundoscope which we are talking about. This is the old version. I'll show you a picture of the new version also. Then of course Dr. Prithvi had the Trash to Treasure Red Cam and the Do-It-Yourself Red Cam by Dr. Biju Raju with myself. Smartphone apps for ophthalmologists. There are so many apps. So I'm not going to go into detail of all the apps, but I'll tell you the main thing which you need is the eye handbook. The eye handbook is very useful because it has many useful tests. Rest of it, it will have some extra tests, but this is the most useful one right now. If you want to see, this is the eye handbook tests which are available: acuity, contrast sensitivity, color vision, and so on. And all these are there in the app, so I'm just going to skip through it quickly. You can also record many things by using the smartphone camera itself. Smartphone refraction is there by iNetra, which is an MIT Media Labs startup by an Indian. This is eye handbook. Eye handbook also has optokinetic nystagmus, drum, pediatric fixation targets, which are very useful. So many calculators, IOL calculators, toric IOL calculators, surgically induced astigmatism calculator, visual acuity converter, so Snellen feet to Snellen meters, logmar, and so on. And of course transpositions. I use transpositions also on the app. And of course the glaucoma risk calculator, glaucoma CCT calculator, and Farnsworth-Munsell 100 hue test. That is available. Okay, Farnsworth-Munsell 15 hue test is available in this particular app. You can arrange this and then calculate the score. Farnsworth Munsell 100 hue test was there on another app which is not there right now. Park's 3-step test, if you find it difficult to remember the simple 3 steps, this app will help you to go step by step. Then there is this thing called stereo tab again for stereopsis testing with the red blue glasses. And also if you just have a Google Cardboard headset, you can use the stereo acuity Google Cardboard test. Visual Fields on the iPad, this app was there called Visual Fields Easy. This was the basis for the MRF, the Melbourne Rapid Fields test, which is commercially available now. So this is the same thing, the initial part of it. This is the free version of it basically. OCT, if you have the OCT files, you can browse it on your iPad. You have to copy the files over and just go through all the slices. If you just want to take a photo, doesn't matter. But if you want to go through all the slices, this will go through the data and show it. And medication compliance, my eye drops app and so many other apps helps the patient to remember the eye drops. IOL vision simulator from Abbott, you can show the patient this is what vision will be with the multifocal, this is what will be with the monofocal. Learning apps, so many are there. 3D human eye. This is the iGrader app. iGrader app is for postgraduate students to remember all the grading systems, and also for other ophthalmologists who want to do research or document their things properly to go through all the grading systems quickly. Language helper apps you already saw. Apps for low vision patients. This is something which is very often overlooked. Sometimes patients are there for whom you cannot do anything. So you tell them, this is what you can do. You don't tell nothing can be done for you. You tell them, this is what can be done for you. You can use these apps which will help your life become easier. Okay? These are apps which will help them navigate their reading, their life, counting money, and so many options are there in this. Okay? This is just a list of apps if you want to take a photo. And last, just quick word about the Jaundice foldable fundoscope, which Dr. Shisher has already covered. So I have a patent pending on it. And how did I design it? Using 3D printing. So I used a free software, of course, FreeCAD, and you can just make all these boxes, and cut it out, put circles, cylinders, and cut it out. Very simple, simple to learn. Go on YouTube and search how to do FreeCAD 3D designing. You can do this. Once you do this, you can go to a 3D printing shop and print it. So this is what it looks like after it is printed. The other one was the design. And this is the final device. It's this is the first model. The later model I will show you. I don't have the picture of the later model. Okay, so the later model has inbuilt illumination and it has a magnetic docking. The phone attaches to it magnetically. It closes into an apple-like curved edges design and fits in your pocket more smoothly. So thank you.
Thank you, Dr. John. That was a wonderful presentation. So, an app for everything, and also right from the beginning of history taking, examination, and right till the end, posterior segment imaging, and much more he has shown you. So it all comes almost full circle.
Next, we have something very, very exciting. This is an innovation by Dr. Prasanna Venkatesh Ramesh, but he is unfortunately had a small accident and he is unable to come. So we will be showing you how the 3D metaverse, the virtual reality metaverse is already here. And you will experience the 3D metaverse of virtual reality in front of your eyes. There is Mr. Tenzing here with the 3D printed models in his hand, virtual reality headset also with him. We will be able to show you the virtual world in front of you. Okay, any volunteers? Okay, first have a look at the 3D models. Volunteers for putting the headset on can please come forward. Dr. Ramna can start the presentation. Volunteers can come forward to experience virtual reality.
Thank you, sir. So let's get into the metaverse of smartphone pedagogy and patient counseling tools. And there is it's not the only method, but we will look into that. So there is a extensive energy and dedication which is there for this presentation, and I'm going to share you the energy from Dr. Prasanna's voice. So if at all you have any lag, or if you feel something is missing, like I just came through everything in yesterday's evening only. So we will be demonstrating you whatever is there, and I'm there as a part of this Mahatma moving images for the past 2.5 years, and we are looking into the presentations here. And this is a glaucoma module which has been uh, published in IJO in February 2022 and June, and now whatever we are experiencing is real-time images, and it's going to be animated videos which is going to you, and it is always there for you to visualize what is happening. And this is the normal anatomy of the iris process, which is we animated, and here you can see the peripheral anterior synechiae in the left. So once the animation is there, you can learn it in a real time, what is happening inside your eye, and you can learn it from the start. So we believe that we will integrate everything with real-time videos, and so we are here to demonstrate you the iris processes in the right. You can see it in the video, and then there is a peripheral anterior synechiae which is there, and this will cause the rise in the intraocular pressure, as you all know. So we will give you the metaphorical out view of what is happening in acute angle closure attack. So right now you can see there is a iris lenticular touch, and there is a closure of the angle, and so that the aqueous is not draining properly, and there is an intraocular pressure rise. So we will give you a detailed scenario with the real-time video. This is a Van Erick's grading, and just giving a VH1, and then you can see there is a YAG PI being done, and real time there is a leak of aqueous from the AC. So when you look into the surgical scenarios, there is always a part which will be looking post-operatively, we will be looking at only at the bleb, and but not the ostium. That is actually a very important aspect of gonioscopy, which should be done post-operatively. You will be looking at a patent ostium on the towards your right, and there will be a blocked ostium in the left, which is there. We will always tend to miss such things. We can easily demonstrate in a real-time video for surgical residents. Then if you look into this laser training, and we are going into the metaverse in a different dimension, we will give you the real-time anatomy, and then when you go into the angle structures in an animated way, which will give you certain aspects which we used to tend to miss in our clinical learning. Here you can look into the eye with normal angles, and then with the oppositional angle closure, where you can indicate with the arrow marks, and then you can go to the organ laser, peripheral iridoplasty, how the oppositional angles are being opened by the organ laser. And here, this is just a front-on view to demonstrate what is happening. There are 24 shots which is placed over 360 degrees, and this is the side-on view. As you can see, when the laser is being applied, and there will be opening of the peripheral anterior synechiae. It can be beautifully demonstrated with the animated videos and learning. So we have published an IJO April 2022 edition of what is the 3D learning can give to a resident from the MBBS to till the person is going to become a resident. They need that anatomy should be learned in a very structural and conceptual way. And this 3D printing models, which has been designated in Mahatma moving images, like we can give you the real-time images. So here's the circle of Willis, which has been printed, and you can see it in your hand, and this is a dural venous sinuses, and all this been available with us, and we can give you the experience for you. And this is our color fundus photograph, which is like we have a hologram and 4D visualization techniques also. What we had did is like we incorporated the real images, fundus images to the 3D model, so that we can learn at the simultaneously the normal fundus, and then along with that you can have the autofluorescence and infrared in the same time, starting from the first year residency itself, so that it will give them a real-time scenario of understanding what is happening inside the retina. You can give this is the flecked retina, and there is autofluorescence and infrared also, which you can demonstrate in a real time. All these images are not animated, everything is a real patient's image, and which we are incorporated in our technology. So this is again there is a color fundus photo of the clinical scenario and the myelinated nerve fiber, which is demonstrated in the infrared fundus image also. Same for the splinter hemorrhages. And if you see this neovascularization, if you see it in a color fundus and you show them in the infrared, and you can even demonstrate a fundus fluorescent angiography. So right now we are going into the metaverse, into the depth. So this metaverse concept has so many components, like all the innovators are doing so much for imaging, and what we can do is like we'll integrate everything into a same channel to give you a 4D experience. So this concept is actually came to mind for Dr. Prasanna with Iron Man's understanding of what is happening in the uh, Avengers scenario. So we have a app, smartphone application for you, IMG AR and IMG Max. These are the QR codes for you. You can real time, you can start using the application, and we have scenarios also. So this is how the instructor is demonstrating the 3D image, which is like an analog, which is printed, and you can use with the app, and you can demonstrate what is happening in the eye. Right now, from the day one, they can learn what is inside the eye from a retina surgeon's view. Just imagine what is happening to a residency training if at all they get a thought process of from the anterior segment to the posterior segment in a real-time view, so that they are learning of anatomy and what the surgical skills they are going to acquire. It will definitely have a serious impact what is happening there. So we can demonstrate with the app, a smartphone application, that itself is enough. So we can construct the images with real-time image, which we can acquire with the confocal image in our center. And you can see the angle structures here. You can really construct that images with the real-time gonioscopy. Again, you can see the normal fundus photo, which is autofluorescence and IR technology can be combined within the same image. So it's all been published in European Journal of Ophthalmology, IJO. You can go through that. And here, this is the best part, which you are going to experience now. Our chief of animation is there, Mr. Tensing is there, and he will be demonstrating you how to feel that in a 4D way to zoom it. You can see what is happening inside the eye. You can pinch and you can analyze all the aspects of eye, which is going to be the future of patient counseling and students education. Whatever we are leaping towards in artificial intelligence and machine learning, this is going to be a definite impact on residency training. As again, there is a counseling part which we always struggle to interact with the patient, what is happening inside the eye. All this can be revolutionized if we can do such kind of demonstration to the patient and their caregivers. So this is going to be your demo video after this session. So it has been published in IJO, the 4D imaging and metaverse concept. So what will happen if a patient comes to you with a diabetic retinopathy? We will acquire all the images, and of course we'll do a OCT, and we'll feed it to our system, and the software will process that, and it will give you an image. The image it will be given in such a way, it will be giving you the complete scenario, all of the OCT in a structural manner. Even all the slices can be demonstrated to you, and then the patient can learn what is happening in their eyes. You can give them a complete brief scenario. So this is the 4D model imaging examination of the retinal diseases. We can demonstrate the surgical residence in a better way. This surgical simulations is going to be is there for you, but for Dr. Prasanna had got this concept from Melbourne conference when he experienced all those things. So after that, when he started doing this eye stent mix procedures, he came to know that the learning process will definitely improve better when you have that experience of doing it in a virtual reality way. In this video, you can see there is definitely there is a device which is like going here and there, and you have to take multiple steps to position the device, which can be overcome if we have a learning experience in a dimensional manner, which can be given only by the augmented reality, which we are going to demonstrate here. This is Mr. Tensing, and he has the VR device and he is utilizing it. Right now I will show you the part which is very important. Like, you can instill, and if the device is lighting to green, you are in the perfect path to understand where you are placing the stent also. So this can be tightened in such a way, and right now you can see nicely the stent is being placed there. So this is how the surgical training should evolve, what we are seeing, and this is patented now by Mahatma Center of Moving Images, and it's been published. So when a child can introduce and child is being experienced in such a way, we can go to different dimension. That is the concept of metaverse, and metaverse is going to definitely revolutionize what we are seeing as a clinicians, and we hope that we'll take it more experience and all the energy forward to the next generation. And Mr. Tensing is here to demonstrate to you what is there with us. And thank you for the great opportunity. And we have models also in the app which you can use to even train from school level till MBBS level. You can utilize all those in a certain manner and in an organized way in IGMG Max application. So thank you all for the opportunity. It is wonderful to be here, and I travel a lot to be here, and I'm happy that I have shared some of the energy of Mr. Prasanna and John sir and Prithvi sir. All of them had given us so much of inspiration, and I'm just carrying the same energy forward. Hopefully when I am here next time, I'll be giving my own innovation here, and thank you all. Thank you so much. Thank you.
Thank you, Dr. Ramanan. We have Tenzin over there who will actually give you a demonstration on the hologram that they've worked on. As the time is out right now, so